HealthCare Community Connection is sponsored by UK HealthCare.
This morning we are joined by Dr. Kevin O'Connor from the UK Neuroscience Institute.
May is American Stroke Month, and Dr. Connor is here to talk about detecting the signs and symptoms for pediatric strokes. Thanks so much for being here. Can you start off kind of by explaining and giving a basic introduction to pediatric strokes?
Yeah, thanks for having me. So pediatric stroke is very similar to adult stroke. When we typically think of strokes in adults, we think of sudden loss of weakness on one side, loss of sensation, vision trouble, language trouble, and we see a lot of those same things in children, but in children it's not quite as common. And part of the problem with diagnosing pediatric stroke takes into account both not being as common, and also when children tend to have those symptoms of weakness or language trouble, it's usually from something that's not a stroke, something like a migraine attack or a seizure. So it can make it kind of challenging to figure out what's going on.
How does treatment differ when you're dealing with an adult who's had a stroke or a child?
So in adults, we like to take pictures of the brain, see what's going on in the brain and the blood vessels, because most of the time when adults have those symptoms, it ends up being a stroke. But in children, because a lot of those pictures often use CT scans, which have some radiation, we tend to be reluctant to use those in children for good reasons. And part of the other reason is that a lot of those symptoms can be from other things that aren't stroke. So we have to be very careful about who we take to scan. So we do a thorough job of figuring out what's going on with the story, what's your examination like, which can be challenging in a child because a 2-year-old may not participate as well as, let's say, a 12-year-old. But then treatment-wise, we have a lot of similar treatments between adults and children, and most of those are time-sensitive, so we really like to emphasize getting to the hospital as quickly as you can so we can figure things out.
Building on that, what is UK HealthCare specifically doing to improve care for pediatric stroke?
So what we've done is we partnered with the University of Louisville and Norton Children's Hospital to develop a sort of statewide triage process where any hospital in the state of Kentucky, if they have a child come in with sudden onset weakness or language or vision trouble, they can give us a call, and we split the state left and right between Norton and UK. You give us a call, we'll walk you through the whole process of trying to figure out what's going on with the child. We'll help you determine, is this person eligible for any of those time-sensitive treatments, and we'll get you to one of our hospitals as quickly as we can, again, either Norton on the left or UK on the right.
Being aware of the symptoms of a stroke is obviously so important for trying to manage it. What do they include?
So we like to use the mnemonic device Be Fast to help people remember the symptoms of stroke, and that applies whether you're a child or an adult. B FAST stands for balance problems, so trouble walking. I problems, whether your eyes are going in different directions or if you lose vision in one or both eyes. F is facial weakness, so if you have a droop or when you smile, it's kind of off center. And then arm and leg, whether you have weakness on one side or loss of sensation. S is your speech, so language trouble, you're not talking well, things aren't making sense to you. And T emphasizes time, where the importance of getting to the hospital as quickly as you can, again, for those time-sensitive treatments.
Which also brings back that you're partnering with Louisville to get one side of the state and the other side to a hospital as quickly as possible. Dr. O'Connor, thanks so much for being with us this morning. We appreciate it.
And you see on the screen, ukhealthcare.uky.edu for more information. You also see their social information. Great to have Dr. O'Connor in this morning.
We'll be right back after the break.